whether it be cancers or whether it be neurodegenerative diseases like MS, like Alzheimer's, ALS, Parkinson's, CTE, concussions, traumatic brain injuries. There could be already treatments in today's drugs that can work. The challenge is whether the drug is in fact working. So we see a lot of opportunity to use these digital biomarkers in blood to determine the drug's effectiveness and its safety. And so now, because of this technology, we can see disease long before symptoms when it's very easy for a drug to actually put the disease out and to do it with lower dose, which keeps it safer.
I attended this PPH Summit today and it's been amazing. We have seen the precision and the sensitivity, the endless fields that people can go with biomarkers. The kind of things that at first couldn't be done with traditional sort of immunoassays.
All these new technologies are really opening new possibilities, and it's very exciting to be the first one experiencing this and being able to test this and feeling we're really at the center of some revolution.
I think that Quanterix is making precision health actually possible. They are providing a whole new world of precision in the healthcare space.
You now can really measure low amounts of cytokines in blood that before was not possible. It was kind of an eye-opener for me today.
Yeah, the main thing with the conference like this is it allows us not only to have the top innovators from Europe attend, but also some of the top investors that are investing in many of these future solutions. And so for the scientists to get exposure to the investors, who then get exposure to Quanterix, having that ability to interrelate and learn from each other what each of their interests are, creates more of a movement.
What I really appreciated was the exchange between different key players in research, doctors, so medical doctors, clinicians that they have a contact with patients every day, scientists that they work hard to establish new assays for really precision detection of the disease, and then as well investors and the companies, because I think it's really important that all of those key players need to work together to make the best precision health for patients in different diseases.
I thought it was a fantastic event. I think just the vision that these guys have to be able to look towards 2030, towards a vision that's not just Quanterix focused, but that brings together the entire community is absolutely what we need in this field. For people who are looking to change the world, they certainly got it here today.
What I was most impressed with was the depth of knowledge of a lot of the clinicians here. So I think today Quanterix has been very valuable in terms of the MS and neurology community. Quanterix is sort of on the cusp of moving into an area where we can really drive much better patient care in the future.
So there was a lot of discussion around multiple sclerosis and many of the neurodegenerative diseases and how this technology can actually detect them long before symptoms.
Myself, I work in neurology, now in multiple sclerosis, and one of the biomarkers that was widely covered today was the neurofilament light. With the really precision in detecting neurofilament light, we can detect the signs of the disease easier. We can see whether the treatment is working or not.
Today, there's about 2.5 million people around the world that are suffering from multiple sclerosis. And it's a disease that's very hard to diagnose. And the way that they do it today is using imaging, a technology that probably is not seeing MS early in the disease cycle. It takes a couple years before MS will affect the brain in a way that you can see it in images. And by measuring NFL, neurofilament light, in blood, you can actually see disease progression. There was a lot of data presented today from some of the top thought leaders in the world that are from right here in Europe, and they were able to correlate it to the shrinkage of the brain or brain atrophy, as well as the relapses that many of the patients have.
NFL now has been shown to be a biomarker of neuronal injury, and which provides a very good checkpoint for drug testing, for drug development.
And it's also helping get new drugs approved by looking at that biomarker to determine whether those drugs are having the proper effect, and so that you can get the right drug for the right patient within maybe 2 to 3 months after the new drug is deployed. Personalized medicine, we think biomarkers, digital biomarkers, and their extraordinary sensitivity is going to open up many opportunities to achieve that.
This is how a complicated technology makes life much simpler.
We're very excited about continuing to go down more and more in the sensitivity to enable even greater fields of opportunity as we do a lot of research and try to really take down cancer and take down neurodegenerative diseases.